what do you think needs to be focused on for the immediate future? So just mention the immediate future and what you see are the needs.
I think we need to strengthen the basic science of the brain, translate it into being relevant for human processes, and both in illness and health, and so we need to strengthen basic science and develop translational science, translate that which is developed in the laboratories to human treatment. One thing that we did not mention that I think is important in terms of the department's development is child and adolescent psychiatry.
Oh, yes.
For a long time, since I'm a trained child psychiatrist, I was very interested in training child psychiatrists. And so we created a consortium involving the Rady Children's Hospital, Los Niños School, and some other things, and put it together for a program of training child psychiatrists. And it was visited by the American Boards of Child and Adolescent Psychiatry, and they said, fine, do it. So we went along with that for quite a while.
What time was this?
This was in the late 70s, early 80s. Okay. Then there came a time when it became clear that we needed an inpatient service for children. We didn't have it. The county had a program that was floundering, really. And so I worked with the then mayor, Roger Hedgecock, to put the service up for bid in the community, which it was. We bid for it and we won it. And we've had it ever since. It's now at Rady Children's Hospital as an inpatient service.
And you've seen that grow since?
Yeah.
Okay. No, that's fine.
It's solid.
Very
good. Department chairs are reviewed every 5 years in the University of California. And each of my reviews has been very, very good. And one of them was so good that the dean said to me, this is wonderful. What can we do for you? I said, you know what you could do for me is to get me a building down at the hospital. We have no space there.
And which hospital?
University.
Okay.
And he and the
Hillcrest?
Yeah.
Okay.
He and the CEO of the hospital went and got a building, excuse me, which had been the Center for AIDS support. But they ran out of money. They closed up and the building was available. I said, go get it. And they did, and we have it now. It's at the hospital, it's 25,000 square feet. We didn't have before.
No, that's huge.
So the department is made up of epochs like this, of acquiring services or people that have emerged in a confluence to the total.
Okay. When did that happen? When did the building?
Probably in the 80s.
Okay. So that was a huge development.
Yeah,
And it was filled immediately.
yeah. And so we acquired the child inpatient service then, and acquired the building at that time, and you can visit it now.
As opposed to not being able to visit, or?
No, you can.
Okay.
Thriving enterprise. One of the major deliverers of mental health care in the whole region.
Were you ever recognized, or the department ever recognized outside of the university for the work that you were
Yes,
doing? Could you mention that? Because I think that's,
yes,
you're going beyond the university for recognition
Yeah.
for what the department's doing.
yeah. For my own recognition as being the representative of the department, I received a honorary degree from the medical school in Ohio. I've received a series of recognitions for my own research. I won the award for bipolar research from the Brain and Behavior Foundation. I won the award for bipolar research from the American College of Psychiatry. And I was elected to the National Institute of Medicine, which is a rare honor for faculty. There are 70 people in psychiatry recognized by the IOM, and there is a field of 15 or 20,000.
And what did, and then name some that the department got recognized for as a department.
Yes. In a way, as a chairman, you represent the department,
Oh, I see.
and your eminence brings eminence to the department.
Okay.
And the faculty, each of them are eminent in their own fields, and that brings eminence to the department.
Through the time you've been here, have you seen more of an interest in students in this field? Or has it stayed about the same as far as it?
I would say it's slightly increased,
Okay.
but it is not as lucrative as other areas of medicine. You know, like surgery, neurosurgery, you know, heart surgery.
So getting this field is more in your heart.
Well, they can charge whatever they want.
Mm-hmm.
And people are willing to pay it because it's one time, you know.